Hi, welcome everybody. You're tuned in to the Banton Runs show. This is the show where we address certain things in the country, the good, the bad, the negatives, the positives, all the things going straight and the ones going astray. We talk about it. And exactly that, like that, today we are all gathered here. And I think you guys will really like this one because it's dear to my heart because I have friends in that sector, and per the conversations we've had, this episode is highly requested and highly needed. So before I introduce the topic, let's go right ahead to introductions. My name is Forever Ajwa Adi, to my right.
I'm Theophilus Aqua.
Hi, Theophilus. You're
Hi.
welcome.
Thank you.
And
I'm Scanty.
Scanty. You, one episode that you didn't appear, did you look at the comment section?
Yeah, I think they have to name everything after me. If I'm not there, the show not there exist.
Wait.
I'm very serious.
Wait.
The numbers speak for itself.
And then finally,
I'm the person Hakim and Steve Smiler. Yes.
Ooh.
I can call him Pakwisi anyway.
Pakwisi.
Yeah, that's
okay,
fine.
nice. So what are we talking about today? The health sector in Ghana. The problems, the not problems, the goods, the things they are facing. Let me start. How long have you been practicing? You're a nurse, right?
Yes, I'm a nurse.
You're a nurse as well?
Yeah.
Okay, that's nice. How long have you been practicing for?
Oh, it's been 3 years now, since
3 years.
2020. Yeah.
Okay. Was that the passion when you were growing up?
Actually, no. But
I think everybody has faced this problem before.
Yeah,
We all
but
diverge.
Shaggy happens.
Shaggy happens, exactly. But what did you want to be?
I think engineering.
Engineering?
Yeah. But
And how did you end up in the health sector instead?
okay, so I went to St. Thomas Aquinas School.
Right.
That's my senior high school.
Okay.
And then after school, I applied as a waiting form.
Mm-hmm.
But unfortunately, I didn't get this engineering courses.
Right.
So I was in the house. So later I realized, anytime I see nurses passing by, like I come out to stand and just look at the person, keep walking, not even to the roadside before the person has vanished from sight.
Right.
I realized, no, I want to apply into nursing.
Okay.
So I spoke to a few people and then they were actually my colleagues from senior high school.
Okay.
They were like, oh, I'm at this particular school. That's Pantine.
Okay.
They sent me the free training college. So I also applied and then
you got it.
I applied Pantine, I applied Tishi. They both gave me admission funds, but I came
You came to Pantine.
Exactly.
Okay.
So you put your dreams away for engineering because you saw nurses pass.
I mean, it worked in the end, right?
Yeah,
So
it worked,
it's
it
all
worked.
good.
Yeah, it's good.
Is it the same for you?
No, I basically followed a lady to do nursing. That's it.
It was from the beginning, no, nursing.
No. Basically, I followed a girl to do nursing.
said
That's
you
it.
You followed a girl to do nursing.
But it's funny
And
though, man.
Wow. Wait, how?
Okay. So when I was growing up, I had a study mate from basic school.
Yeah.
And it happened I went to Presec and then she also went to National. But we
Okay.
studied together and all that. But we had this thing she was saying that she would do engineering or nothing else. Wanted to do medicine. But it happened that after school, her other brother did engineering, hadn't gotten a job yet. So her mommy recommended she do that midwifery.
Yeah.
But she was redundant. So she spoke to me and I was like, oh, it's good. You should. So she went in and at that time, my auntie also head of department UCC.
Yeah.
So she was like, oh, I can actually do nursing and come to. I was like, nah. So my brother was having a conversation with the lady and said, and the lady was like, but you have recommended for me to go and
Right.
do WhatsApp. So, okay, no problem. So I just went in, but
I see.
that's just why I went to nursing school.
There's this notion out there that people end up in nursing when all else fails. Is it true? It's there. Not exactly nursing, but government most of the time.
No, the nursing most of the time.
The nursing most of the time. Like,
Not exactly.
because if you speak to people out there, like 80% of them will tell you that, they wanted to do this, it didn't work,
Yeah,
and then they went to nursing.
yes.
Not exactly, because I actually know people who actually wanted to do nursing.
Okay.
And you see, nursing basically, for example, if you go for you to do nursing from the degree level straight up, you have to get a single number.
Okay.
Yeah, so you shouldn't be that everything is wise for you to go there.
Mm-hmm.
Sincerely speaking, if you're done, you can't even do nursing.
Okay.
That's
But if you want to do nursing degree, you need to get a single number
Single. Oh, of course.
Sure.
from WASI.
Yes.
It's degree.
From these
But then
public
if
universities.
not,
It's just recently these private universities came in, and I think the cutoff has been reduced a little.
But even with the private universities, the requirement for you to do nursing is the same thing to do law and everything.
Is it?
Yes, it is.
Nursing.
Yes.
Yeah, sure.
But it's more like the training. If you train the people, they were those people plenty past those who want to do the degree.
I think if you have like a small, if you have like a, I don't want to say bad results, but if your result isn't that good like that, you can apply to be a community nurse, no?
So the thing actually
before you use that to
make me
apply to a higher.
The nursing, I know we have people who wear white. Like
Yes.
no, even the students.
Right.
And then we have who wear the
Brown,
the
green.
brown.
So-
Yeah, brown day.
you see we have
Brown day.
Yes.
so we have the nursing
Let him after a second.
with different categories.
Okay.
Right. Exactly. The funny thing is that the requirement you use to enter diploma nursing is the same to enter a degree nursing. Yes.
Okay.
Just that diploma you are going to do 3 years, degree you are going to do 4 years.
4 years.
Exactly.
Okay.
And people are doing the diploma because of allowances.
Why the degree they don't give you allowance?
Degree, they give you allowance.
Oh, okay.
Wait, how? Why?
Because the diploma nursing trainings belongs to the government, basically. You understand?
Okay.
And then at the time, until recently, when you do degree straight up, you are not automatically posted. You get it? Because the diploma people, like as in we that go to the training college and all that, at that time there was a bond. So when you are done with school, there's a fiduciary duty for the government to actually post you directly. Until recently.
See.
Yeah, so you could realize that those times people complete central university and all that, and they wouldn't be posted.
Yeah.
And so I think about some 5 years ago, they started posting them. Yeah, so
Okay.
that's one of the things. Aside that, we also have grades in nursing as well. Where we have the community health nurses. It's not like if you don't pass, at least you have an average pass
Okay.
to even apply to that.
Okay.
Yeah. So the notion out there that if you have very bad grades, you can go to nursing school. There are other health aid programs and all those things around there. They are not necessary. We don't categorize them.
right.
Yeah, I
as
think
nurses.
people mistaking and then put
Exactly.
all of them together
Yes.
in a box
Yes,
collectively.
yes.
as
But what she was
nurses.
saying, if you speak to a lot of nurses, just like the two, say, I wanted to be a policeman, later I'm a nurse.
I'm a nurse.
I wanted to be a doctor, later I'm a nurse. I wanted to be a
So
this.
Is it an
There is
entry to
actually a
nursing
saying-
is easy?
Okay,
It's not.
there's actually a saying that nursing is a call or it's a calling.
Okay.
If you are not being called, you can't actually
But now it's
do the
not.
work. Okay, it's still a call because even we that we are in, we will get it. But some of us we wish maybe we was it or something, or probably not practice nursing in Ghana.
Right.
But with the entry, just as you are saying, we have the certificates, the diploma level, and the degree level.
Yeah.
So initially we're discussing that of the degree. So with the certificate, probably it's a 2-year program. The diploma is a 3-year program, and the
Okay.
degree is a 4-year program. With the certificate, that's where you see there's the community health nurse and what we call the nurse assistant. So we have nurse assistant preventive. They are now the community health nurses.
Okay.
The preventive. Then we have the nurse
Omo na mo share
assistant
den colour.
brown.
Brown.
Those
Yes.
who
Okay.
their duties is the weighing.
And even the
that's
brown, the
it.
reason they wear the brown is not because of less of it. You see, they are trained to be in the communities.
Community, yeah. Okay.
And we know how the community and then
dirty.
yes,
It's dirty.
like it's not like the
Like,
dust and all
they
those
don't
things.
have good roads.
That is
So
why
probably to-
they have
They
that
wear the
particular
brown.
uniform.
Exactly.
Okay.
So that they are
Oh, that makes
uniforms
sense, actually.
do
So
not
you
get-
see, people even mistaking it with even the uniforms. You see, the fact that you get somebody wearing white uniform doesn't necessarily mean the person's a nurse. You have this 6-month, 1-year program. Do you see them giving them white uniforms?
the
They are still not nurses.
They are
MVTI
still not
nurses.
nurses.
Yeah,
They are
they
still
are
not
not
nurses.
nurses.
I
They
see.
don't have
Because if
nurses.
you see, to be a nurse in Ghana, you write a license.
So
You have a license
Okay.
from the Nurse and Midwifery Council of Ghana to be
Do
a
they
nurse.
issue those easily?
No,
You have
you
to
write
write an
license.
entrance
You see the way now
like-
teachers are not writing license exams, they are
Exams.
failing.
Yeah.
Every nurse you see on the ward have
Pass
passed the
license
license exams.
Oh.
after
Yeah.
training.
As people make it seem.
So, for example, if nurses are dumb, for example, now how come we have nurses who are lawyers?
Well,
for example, I have a degree in nursing and I'm reading law. So if I'm dumb, how will I be reading law? And I have a GPA of 3.68.
Yeah.
So nurses are not dumb.
Okay.
You understand? It's not even easy because, for example, when you come to the ward, the patients are actually in the care of the nurses, not the doctors.
Okay.
Yes. So 24 hours, the patients in the ward are with the nurses. Right?
The doctors just come, prescribe, diagnose.
And even if diagnosis and everything, things are wrong, we expect that the nurses should know that what you are writing is wrong. So as a nurse, you do what the phlebotomist will do, as to take sample, to set lines and all that. As a nurse, there are certain things that you prescribe, you take care of the patients, everything. When you go to dialysis units, you see the nurses who are manning there. Critical care units.
I see. So it's intensive like that.
Yes, it's actually intensive. That's why you see a lot of people actually end up breaking down. For example, people run 72-hour shifts non-stop.
I see.
3 days. People do 24 hours. I just closed for a 12-hour shift.
Damn.
Basically.
This brings me to this question.
Exactly.
Do you like being a nurse? Do you enjoy it?
Well, it comes in two ways.
Okay.
The aspect of you trying to help people makes you feel achieved, for example.
Okay.
If you are in the other sectors of nursing, quite unfortunate, my ward, for example, majority of the patient may not come out alive, right? Internal medicine is just like that. Because internal medicine comes that way. So that's the down part of it. But the joy you have is somebody comes in a very deplorable state, but you're able to manage the person until the person goes home. You feel so happy and elated.
Okay.
That's it. But what will not make you happy is that you put in a lot, but the reward out of it is not as you expect it to be.
Yeah, baho.
Right.
Reward.
Okay. When I say reward, I mean the remunerations. For example, as a nursing officer with a degree,
yes,
and say if you're making a little about 3,000, right?
Yeah.
Good. Your colleagues, NOs, right? In, let's say, like with a degree in the police or army, makes about twice or thrice of what you make.
Your payment.
Okay. Wow. Now let me even surprise you. A doctor who's in a house job, right? First day house job. That's, like the rotation. What we do, national service.
National,
okay.
So a doctor doing their national service.
Yes. First year house officer takes 4,700.
That's more than the nurses take.
Second year house officer take 5,300.
If you
when you start working, around 7K. Now, the highest rank of nursing.
The highest rank in nursing. That's what we call
it makes sometimes it's not proportional. That's what you looking in there. Do you understand? Yes. So there's a good side of it and there's the bad side of it. When it comes to you making your patients go home safely and all that, you feel elated and all that.
Yeah, it makes you feel fulfilled.
Yes.
Yeah.
But when you, after Charlie, a lot of shifts and you bab, who's got them my watch? You know, my watch is very small.
Very small. it's
so that's it. Yeah, the money, it's few. I agree to my colleague, and at times, just as he was saying, we spend more time with the patient. I, for instance, I work at the burns unit.
What's that?
So anything related to burns, like fire, flame, gas, explosion, electricity, acid, like on somebody, everything. That's the unit I am. And then it's like an intensive care. It's an intensive care unit. Yeah. So we have to eventually do everything for the patient. Then maybe if the patient is a psychological care, the psychologist just come, talk to the person like 10 minutes. He's gone. The therapist come, just touch the arms, the limbs. Yeah. He's also gone. Dietitian comes, write something, they are gone. Yeah, but the nurse have to be there.
So it means
more than
your job.
It means your work is intense.
Yeah, the doctor will just come and review in the morning.
But then you don't get...
For his unit, for example, let's say they may have just 2 patients. They may have 6 people on duty. Out of the 6.
Just 2 patients, but 6 people on duty.
You won't sit. You will not sit till you finish your shift. And those who take up will just take up whilst you're standing. Where you are, and then you continue.
Wow.
Yes, that's how his unit is. Because it happens that you may have a patient who is on ventilator. That same patient having suctioning. That patient is arresting. When you see somebody is arresting me, their heart is just stopping.
It's going into
crashing.
cardiac arrest.
They're doing CPR. That same patient, you're having catheter on. Patient has NG tube.
It's an intensive care unit.
And immediately you stop, the person is dying, right? The medication are just giving it something. You have to even, you see, when even medication are being prescribed down there, just give you, administer it. The nurses know how it's been administered. The doctors don't even know how it's done. Some of them, you have to calculate it before you give. If you give just a ml more, you are killing the patient.
So why is it that they look down on you nurses? That's what I don't understand.
I think it's availability. And then maybe some formations we don't bring out. Because
if you didn't describe it like this, I wouldn't have
just like
seen how intense
saying
it was.
Somebody there's entered into nursing. Maybe it's a cheap entry. Nurses are disrespectful. I think they don't know who we are. That's how I think. Yeah.
And I also look at it. Maybe depends on the
if you are the intensive care unit, Yenson Yeba Hospital, no. We deal with the nurses. We see you. Some of them, some nurses to me, boo, you want to go home and treat yourself.
So what I've
some nurses to see. I've been to the hospital sometime. Malaria. I went to the hospital in the afternoon. The doctor asked me, why did I report for malaria in the afternoon? I should have come early morning. Who can't sing with him? Now malaria, I'm malaria time now. Sometimes you go to the facility and then I don't know if it's because they are not well paid or music council.
So that could be a factor. Maybe, but not really because
I'm not fine. I know that when I come to this hospital,
so you feel like it was a nurse normal cockroach?
No, you are the facility.
That is what actually we have to do. That is what we have to do. But at times, we don't have media. Like
on behalf of my colleagues everywhere in Ghana, I apologize for maybe some of the excesses. However, I would want you to see the intents of certain things. We work in tertiary facilities, right? That's the OPD nurses see 300 patients a day. Yes. Greater Accra Regional Hospital, OPD nurses, averagely, they see 300 patients a day. And there are 3 on duty. 3.
Exactly.
One at the nurses station checking BPs, right? One at the nurses station making records. One calling the names and all that, right? And seeing 300 people, allocating them to, what do you call it?
The doctor for
consulting rooms. And all that. Imagine seeing 300 people in a day. Now, about to close your shift.
No, it'll be the malaria baby.
You see, I'm not saying that it is wrong. No, I'm not saying it's wrong. I'm trying to say that look at the issues. You see 300 people because when you come on shift, sometimes before you come to work, the whole OPD is full. Corridor all is for you. Imagine about 2. You are supposed to go. Closing your as a walk bank 459.
Yes, exactly.
Walk bank 459. Exactly. Now, fiance our ban. Sometimes, if you don't have the patience and all those things, you may go overboard. That's why I say I'll apologize on behalf of the excesses.
But honestly, I don't even think it's just you nurses. Those things, it happens everywhere. In every profession.
If a Oko Bank 459 near 0.5 and is cassette.
No, but
this is my health.
It is your own money. But look at the way they are treating you.
I mean to me Oko Bank. Yes, if I don't have the money, Oko Bank.
But eventually, were you taking care of or you weren't?
Me.
Were you taking care of?
Or trade room, mommy. One beside me say, see, I've been to the hospital where you check. Me say,
but say, or throw a drone now.
Say, me coffee. Say, son, come to my woofy. I can talk to a doctor from the house. If that's what I wanted.
But do you know we have telemedicine as well?
What's that?
What?
Telemedicine.
What's that?
Whereby they'll just call.
This woman was actually doing it.
You ask whatever is wrong with you.
You describe your ailment and then they prescribe.
Yes.
Wait,
not your trauma.
And how person feel?
No. You see, opentema pong. Here, you checking my temperature.
Oh, are you sure?
Yes.
Now you are Kasano, when you were coming from home, you've diagnosed yourself. You said you have malaria.
They only send me the me yaribi and malaria. It's me that's the norm.
Okay.
It's me bano so it's malaria or any malaria. Me by why am I reporting at this?
But
time?
were you tested for?
Tested for what?
So what drug?
Me call you. Do you have health insurance? Yes,
Okay.
I have a card from the hospital already.
Yeah.
It's me call. Do you have health insurance? Yes, I have health insurance. Yeah, check. You say, "Yeah, Juma. Okay, I'm gonna show you. Big book. Bring my folder. Go and see the doctor." When I enter, the doctor asks me, "Why did I report to the hospital this time?"
Okay.
And obviously, I said, "Then I hear me. Me say, oh, I feel shiv me tia me yano or chocho. Do go to the pharmacy. Go and take medicine."
That's what I'm saying.
And you see,
Okay,
the questions he
I feel
asked me, I am a yasam about hospital. So now I don't
You
go
feel
to
like he
hospital
didn't
again. Say
really...
doctor Mwa bisa me question where and the
Okay,
next
so-
then
But we have what we call systemic inquiry. What he did wasn't wrong.
But
Systemic
why
inquiry.
am I reporting
But
to the
I'm
hospital?
coming
No,
though.
that's why I apologize for that.
Meshiao. The hospital my baby shia.
But-
I apologize for
You-
that.
Right.
But the questions that he asked you,
They were
they're
in
legitimate
order.
questions.
Right.
Why are the reports?
No,
But
that
yeah,
one
but
is
not
the
check.
excess.
Right.
But the business said,
Yeah,
then
only
yeah,
but
we
probably
follow,
he treated it
then-
based on
the
experience. That's
way
it.
you see when he was even talking to me, you see the folders plenty. So when I entered, he was asking me, "What's your name?" Now me who Sheldon family, so I couldn't speak out. This man was shouting at me.
Yes, there's also
Like-
this thing that
Okay.
people who
Oh,
work...
So
babe.
probably I'm not sure the person is a nurse.
They say-
Then we are
But
sorry, we
you
are
see,
sorry. No,
people-
irrespective, we
yeah,
are sorry
fine.
for them.
People
This
who work
also
in the
draws
health
my
sector, they
attention.
have short temper.
This also draws
That's
my
what they
attention.
say.
Somebody went to, let's say, a morgue or a mortuary and said, we call her nurse, no one shami. Meanwhile, the morgue, nurses are not there. So at times people don't know if this person is a dietitian, this person
They
is
can't
a
tell the
nurse, this person is a
difference.
records
Right.
keeper.
They classify it all as
or a
nurse.
nurse.
Not
or
compare
a
the
nurse.
mortuary.
You
So
see,
these are some of the
that's
names
the
we
notion that you
get
have
that
to
I
be
was
a
like,
hospital, be a nurse. But it's not everybody who's a nurse.
Right.
You get it? You see, so that is this. But I think that's I'm just saying that you apply for the excesses. Baby, fear, mensa, women, all those things.
Right.
Sure.
So let's assume that's
Oh,
a
yeah.
nurse.
Wow.
No, basically, you see, it says a human institution. Even in the army, you see that certain people you give others to give warning shot. They aim and shoot, right?
Yeah.
So these are excesses that will happen, but we should always not capitalize on the negatives, but we should
Right.
look at the positives that nurses do. For example, you see immunizations. I could have shown you videos of some of our colleagues at places where no doctor would take postings to. They cross river, They do baby a motor no man am this canoe.
Canoe.
No
Ah,
cow canoe.
but
The
yeah.
nurses will
No,
now
man paddle.
be paddling the canoe.
Wow.
Cross, yes,
With
female
the
nurses.
motor.
Yes. So when you go to the community health nursing training, they teach them how to even ride bikes.
Hey.
Motorbikes. Yes.
Motorbikes,
Yes.
yeah.
Yes.
If you don't know, you even
And
learn
that's
on the job.
You understand?
Yeah.
So community
Yeah.
health, no community health nurse like is practicing that can't ride a motorbike. That is why we don't even have community health nursing training in Accra.
So who do we blame?
Is it?
So,
So you
Who do
see,
we blame?
the issues are just mirrored. You understand? Like Edosun. Into imagine so ko two obi say wako ye we you baby say we twa nsuo aba how we you na afiansa abo 3.
Afia
When
sa
twa man tem na obeka nsuo ne so na afiansa wo ba. Senior, me cry na hwea me.
So the public should
No, but
consider
you see-
all of these.
Yes.
exactly. Rather than reacting to
if you have
everything.
passion for the job, ubeye juma na ubeye ni. If see
Boss.
before you
Certain
enter,
things
no,
you-
before you enter
Your
the
passion
nursing,
sometimes can be killed by bad conditions. Let's
no,
be
before you enter into the nursing in Ghana here,
yeah.
you know, say realistically, nurses are not well paid. Before I enter, I know
Okay.
the terms and the services for nurses are not that good. But because I have the passion, I still want to be a nurse. So it's not like people don't know the conditions. Yeah,
you don't
sector
know
be
why-
abreu. Creative sector, yeah, every
Scanty.
sector they suffer.
Some of these things, some of us too don't, genuinely we don't know.
You don't know.
And it's when I was
People don't.
applying for school, I didn't know what nursing
You
entails.
applied by
Until-
seeing
is that
people
he just
wearing
told you
uniform.
exactly. So I saw the uniform.
Maybe
just
that's the
passing,
calling he's talking about. He
and
was
I
called by the
admire
uniform.
it. I admire it that in your nurse, meye. And I applied it, but as soon as I entered. That is where we are going to actually see who a nurse is. And that's why I'm saying that the public doesn't know,
They don't know
who a nurse
what's
is,
in-
what it
exactly.
entails. Because I was using my place as an example, like the bench unit, where imagine somebody bends with the arms. It means eventually the person can't feed. and probably you manage everything.
So you are
going to feed them. You go and wash the bowl. The patient vomit. You come and do. It's just like you doing.
Yes, the patient will defecate, you clean.
People will be on diaper.
Basically, yes.
Adults, you have to.
Adult diaper challenge.
Size.
Big sizes.
They carry adult.
Chairman. And even with my side, where I am, we are already at hospital. Unfortunately, it's my senior both from Cali at the hospital as well.
That's cool.
Yeah.
And they what's up at gym?
Imagine there's something like boss to be when you're bench and even in the dressing, because of this pain and other things, we have to sedate them, like give them drugs for them to go off so you can do proper dressing for them. And as soon as you give the drug, it's just like the person is unconscious or dead. Imagine lifting just one arm. Look at the size of it. So in one dressing, we have about 6 people doing one dressing, which can last like 1 hour. It depends on the percentage of bends.
Right.
Oh, baby, relative consumption, how you throw shit. But
some more.
So at times,
yeah, I get you. Before we exhaust time, let's talk about some of the frustrations that you guys face as nurses. As a government nurse, what are some of the frustrations? Because we've had instances where people enter the nursing sector and then they're like, okay, they quit the country in total. It's not like they quit the nursing, they quit the country. They go. We've seen nurses line up at the Japa. We've seen nurses Canadian.
Now they fly past every Jumabi organ.
Nurse. There's this trend on TikTok. That's 90% air nurses.
It's fine. And
you see,
we're back now with today.
It's fine.
So comedy by Abuaye. Because it looks like now vacancy about outside, baby. Like there's more vacancy outside. Today. And then moreover, upon all this work we do, we will say government and shall them value that much. And even some of the populace, the answer chairman will for AOPD service. But you go to the bank and they still out be like, wait, I'm going for a break and there's something that will be they don't mind you, but you don't compare your own money. But the few people feel okay with that. But as a nurse, said Tago said there you into this job by like this traveling jackpot thing. Yeah. And then if your own people doesn't value you, somebody is valuing you outside, paying you per hour something good. Chance not better. So Ghana here.
Fly away, Peter.
Yes,
fly away.
The requirements are there. Write to IELTS exams. If you want to go to the UK, write the CBT exams and you go. If you want the US to write the NCLEX exams, then you can go.
Interesting.
And so it's the issue of the day. Because government.
Wow.
Igbo school here, go the university for here.
Don't say that. Now, don't say that.
The thing that she also gets it is, I wanted to start from where the question was like, what are the conditions like a government nurse? Like, I'm a meticulous person. I want to take things in details. Government nurses' conditions are about 98% better than those in the private sectors.
Is it?
Yes. And I'll give, yes. With the exception of certain private hospitals.
Okay.
Right? Certain private hospitals, like the quasi-governmental hospitals, like say Kokobo, Trust, then let's say you look at this few, British Canada and all those things. But aside that, those private hospitals, what did you
I see.
Yes, I'm serious. Yes, I'm 100% serious. You see, and I'm not to say like, to ease stress, you understand?
Okay.
Like you want additional coins and all those things. Like it's nothing to write about. You see, that's one thing I want to say. I want to establish the fact that the government nurses, in as much as the conditions are bad, it is better.
How is it better?
Better because one is better because of terms of salary. 2, in terms of
government people, you earn more than
exactly.
Yes.
That's
so I'm
he
sure
made an exception of the quiz.
You see, so let me just take time and take you in terms of salary, in terms of your leave, in terms of end of service benefits, in terms of let's say your promotion, in terms of I like to build points. Right?
Okay,
these are aspects you can say that government nurses and better than private nurses in Ghana. That's why when postings come, somebody who actually pay 10,000 to be posted into government sector. That's established. Two, it's not everybody who is actually interested in wanting to travel like that.
Okay.
If would know, I wrote IELTS and had 8.5. A lot of people don't even get 7.0.
What being? Yes.
I mean, being
what being?
No,
yes,
yes.
IELTS.
Yes. After the show, I'll show you my results. Yes.
Wow.
After the show,
Shock you?
Yes. You see, but then it's not everybody who would want to leave.
But why did you write it?
Okay. So I wrote for two basic reasons.
If you don't want to travel, why you write out?
I wrote for two basic reasons. One for school and then others. Right? Good. So basically, I wanted to have gone to the program outside.
Okay.
But then I had the opportunity to do the law. Okay. And I feel that with the law and then some masters be somewhere and all these things, you can actually make the health sector better.
Better.
You get it?
I think it's a good combination, though.
You see,
and health.
Indeed, people are traveling. It's not because, like, any of they say, like, they're just traveling.
But
you see,
we are angry.
You see,
angry with the government.
Memo class.
You see, there are certain instances that indeed, the government is actually not taking care of people as they're supposed to look at it. Indeed, you can also say the work that nurses do is extreme.
Yes.
And then they don't earn much. But when you also compare it to other sectors, Charlie, I always said, unless an emergency, never marry a teacher.
Unless
it's an emergency, never marry a teacher. Yes.
Hey!
The point I'm trying to say this is that, you see, nurses, their service are not as we expected.
Okay.
But it's better than teachers.
It's fine.
I see.
Yes.
It's better than teachers,
see,
sure.
Those who are even traveling to the UK, if you like find out from them, when they get to the UK, it's a stepping stone. They are jackpotting from UK too. Because because the UK salary is also not
enough.
It's
emoji then.
Yeah.
What was saying? So this our plea is.
You understand?
Our plea is.
So
I
was building to let you know that, and you said the person is.
It's simple as
and
that.
you said the person is willing to just to travel, but there's imagine if let's say a nurse is making about 10,000 a month
in Ghana.
Yes.
Is it realistic?
I'm saying if I'm saying condition precedence.
Okay.
If certain nurses are making 10,000, right? They won't go anywhere.
Okay.
Even 5K won't
So
go.
why is it that they don't
Even 5K won't go.
Why is it that they don't give you what
go.
you are worth so that you stay?
I don't know, sir. No, only ministries. This will be some. No, you're saying why they don't give out. You see.
Maybe they think that you don't deserve that.
No.
Or what do you think is the problem?
The problem is
about negotiation.
I don't know.
Who the negotiate?
You see,
you know,
it's a negotiation.
Every 2 to 3 years, there's what we call a tripartite committee.
Okay, yeah,
right?
I've heard of that before.
Yes. Tripartite committee that negotiates salary increments and all those things.
I think it's ongoing this year.
You heard about what we call COLA. You heard of what we call COLA, cost of living allowance, that came because we said that things were being increased and all those people wanted to go on strike. Good. They gave the cost of living allowance. Now, when they went to negotiate for salary increment, they increased their salary and then they made them withdraw the cost of living allowance. What have you done? 90 0.
So it's a problem of the people who lead you guys for the negotiation.
That is one.
Oh,
two.
I don't think so.
No, but if
I feel like those people in higher power in your sector, they are okay. They have better conditions.
They don't.
That is.
If they don't, then how come they can't speak?
Okay, but let me cite an example.
They demonstrate past every.
That's also not true.
Because of our condition of service.
That's also not true.
But it's still not working.
The demonstration are nursing students.
And your nurses
no. Chairman, let's be honest. Both students and staffs are doing it.
But when
the demonstration,
when you see a student demonstrating, then they are demonstrating for their postings.
Okay.
Or probably they are training allowance.
Okay, so not the nurses.
But when you see a staff nursing going on demonstration or strike or want to go, then it's based on condition of service.
Okay.
And these services,
and I can tell in the last 20 years, nurses have gone on strike just once.
Okay. Now, what strike can say?
You see, let me say,
that puts something like an embargo on us not to go to strike.
That is actually not.
That's why I'm not going, but we wish we would go.
It is not. That's not it. You see, I also want to look at circumstantial evidence that happens. You see, sometimes the nurses will look at the empathetic nature of the work. Nurses went on strike for 3 days. Their death toll.
Of course,
because you see. It happens that, okay, nurses pen aqua strike. Doctors are there, lab people are there, everybody's there. Doctor come and stand on the ward. On one patient, only ward and pour that.
I
Right?
see.
Good. Now, if it is when you go to the other local hospital, they still use the folder and those things. The arrangement of the folder, even syringes and all those, even take care of the patients. Only baby.
They don't know where it is. Yeah.
Right. But when the doctors go on strike, the polyclinics, the primary health works normally. You will not even feel that until the emergency care and the specialist cares that you tend to feel what it is.
Yeah.
Right. In the last 20 years, nurses are just gone on strike just once. And they went on strike for 3 days. Right? Good. And they were called back.
So it be the students.
The students, me, 2016 like this, we lead demonstration. I was a student leader.
So the students when they go on the demonstration.
I don't know, they are in a few minutes.
Before we go, I want to ask you one question. You see, you mentioned, say, the government workers, they earn more than the private workers.
Yes.
Yes.
You mean
but
nurses?
In terms of the receiving the money, why in the bantam? Because you see government, there's also 3 months.
I would say government.
People, they pay you very fast.
No, you see, government, our pay comes from controller.
Controller
and accountancy department, like Ministry of Finance.
Okay.
It's a department that pays salary.
So there is no delays.
No, there's no delay. There's a calendar for salary.
When you see a nurse and the salary, you delay.
In the bank.
And you're aside bank. When you are posted first, like fresh postings, right? These fresh postings in a bar, sometimes, processes and all those for your district have to process you to the municipal and all those things for you to go through that channel. That particular channel, some people, it's me the best say 8 months. But even if the 8 months, from where I sit, your back pay will be paid.
It's paid, yeah.
So there's no way say salary like 6 years.
No.
Nobody has backlog.
No.
If
you have a backlog, it could be, say, let's say, promotion.
I don't care about
sometimes somebody in promotion backlog.
If someone complain and watch him, maybe a newly posted nurse who have to wait about 8 months to 10 months before his salary starts paying. But once it's been paid, it comes every month.
How much do you want to be paid?
No, you see, Bahamas, the country itself, Obia, that's the truth.
And so memo.
You see, the thing is, you see, let me give you a typical example. Why the Obekas and the council. You work around, let's say, Ridge Hospital.
Yeah.
Okay. And then you stay around Pupasia Masamai. Okay, that's how far they stay. Because you can't rent around Ridge. Currently, so the condos, if you can, you can't. So the person's transport for a month alone is about 1,500. So if the person's living an NO and is taking 3,200, or they have a car, you get it.
Yeah.
That is some of the challenges.
Okay.
But if let's say bungalows attached, for example, policemen. They have an allowance
they have housing allowances and everything.
For rooms.
Yeah.
I know that private constables are even taking 455 cedis.
Okay.
Accra, 455 can give you a decent single self-contained something.
Do nurses have that?
No.
Okay.
Nothing.
Until recently, they gave us what do you call it?
Uniform allowance.
The uniform allowance is a whole year.
Uniform allowance.
Yes.
So
see, it's broad. It's broad.
Yes,
we'll take this again, and then I think the next time we'll have females on board because I have some questions for the females too. So maybe next time you bring me some female nurses, and then we'll tackle it like that. But with what we've floored today, what do you guys think? What do you guys think? When your opportunity, would you want to be a nurse? And then what do you think, are some of the things that go on that you like, you don't like? Let's discuss it in the comment section. Make sure you subscribe to the channel, like the video. We'll be back. Peace out.